In this video we introduced a technique about arthroscopic primary repair of the anterior cruciate ligament tears using a continuous bundle suture technique with simplified suture passing. All the authors have no conflicts of interests. The patient is draped in supine position, and the affected right knee is disinfected in a standardized fashion and placed in 90 degrees flexion for arthroscopic ACL surgery. Anterior medial portal as observation portal. An arthroscopic inspection and determination of the proximal ACL acute tears were performed. A 4.5 mm suture anchor was placed on the footprint of proximal ACL from the anterior medial portal. Then with the knee in the figure of 4 position, 3 sutures of the anchor were pulled out of the anterolateral portal, leaving 1 blue color suture placed in the anteromedial portal. The end of the suture about 2 to 3 centimeters in length was loaded into the left curved suture hook, which loaded with a suture passer at the distance about 2 to 3 centimeters away from the outlet of suture hook. And 3 consecutive sutures with automatic suture thread passing was performed through the anteromedial portal. After each suture, at the end of the blue color anchor suture was pulled out from the anteromedial portal and loaded again. Then the 3 anchor sutures were pulled out of the anteromedial portal, leaving 1 white color suture placed in the anterolateral portal. Similarly, we used the anterior medial portal as the observation approach and placed the right curved suture hook loaded with the end of the white color suture from the anterolateral portal to perform 3 consecutive sutures with simplified suture passing through continuous sutures on both anteromedial and posterolateral bundles. The stump of the ACL is sutured in reverse. The video shows that the anchor sutures of different colors were tied and fixed separately. After the sutures were completed and the ACL remnant was well refixed on the femoral footprint area to achieve maximal wall contact.